tool list has been developed by the Research to Practice Project. The Research to Practice Project is one part of the Wisconsin Birth to 3 program's plan to use funds obtained through the Federal American Rescue Plan Act, or ARPA, to implement activities that support families, infants, and toddlers with a focus on social and emotional development, racial and health equity, and the disproportionate impacts of COVID-19. There were a variety of factors that contributed to the development of the approved tool list. One of the initial tasks of the Research to Practice Project team was to identify key tools and practices necessary for successful implementation of early intervention services to children and families in the Birth to 3 program. Given the ARPA funding guidelines, the Research to Practice Project team determined that supporting consistent assessment practices across the state would also provide more assurance of consistent, equitable access to services. Data gathered from workforce surveys, engagement sessions, and regional forums indicated that the workforce was interested in creating consistent statewide practices. The data also revealed inconsistencies with terminology and practice related to assessment across counties and practitioners. Additionally, downward trends in child outcome rating data prompted a critical examination of service provision, including evaluation and assessment practices. This journey started in July of 2021 when ARPA funding was allocated to professional development redesign. By October of 2021, the Research to Practice Project team was comprised. In the first part of 2022, the Research to Practice Project team gathered, organized, and reviewed a list of over 55 tools and practices that had been identified as common to the field of early intervention or were reported to be used in the Wisconsin Birth to 3 program. As a part of this work, it was critical that the team not only explored the tools, but also considered their relationship to core concepts such as authentic assessment, family-centeredness, and individualization. In the second part of 2022, a set of 5 tip sheets were developed to help promote a common understanding and a common language regarding assessment practices. In the first part of 2023, the tip sheets were released and additional materials were developed to accompany the approved tool list. Here's a bit more about the Research to Practice Project team's process. Once the comprehensive list of assessment tools was developed, the team established criteria and a process for their thorough review. The tools were researched systematically and consensus was confirmed among team members. The team created a spreadsheet that organized the tools and captured the rating criteria in addition to a variety of useful details about each tool. Finally, the team selected the top-rated tools and categorized these according to their assessment purpose. An exploration tool that comes from the field of implementation science was used to select the specific criteria. These include need, or the understanding of the population, relevant data, and community perception in order to assess needs and assets. Evidence, fidelity, and the strength of evidence for conditions. Fit, the alignment with community values and priorities, and consideration for the potential impact on other initiatives. Capacity, the resources needed and available for implementation. Usability, the ability to create a well-defined process and to adapt for a given context. And finally, supports, the availability of expert assistance and external resources.